Still exhausted even though your thyroid labs are normal? The problem may not be your dose. It may be your medication. Let's talk about your options. Hi, I'm Whitney Morgan, a functional diagnostic nutrition practitioner and thyroid health educator. In this video, we'll explore the different thyroid hormone replacement options from prescription medications to over-the-counter products. My goal isn't to tell you which one is best. It's to help you understand your options so you can have more informed conversations with your healthcare provider. So let's get started. One of the biggest misconceptions in thyroid care is that there's one best medication for everyone. In reality, thyroid hormone replacement is highly individualized. Some people do well on T4-only medications, while others feel better with added T3, prescription glandular products, or compounded formulations. The goal isn't to find a medication that works best for someone else. It's to understand your options and work with your healthcare provider to determine the approach that best fits your unique needs and symptoms. Any decisions regarding thyroid medication should be made with a qualified healthcare provider. Medication adjustments can have significant effects on metabolism, cardiovascular function, energy levels, and overall health. So please view this information as educational background rather than treatment recommendations. T4-only medications, including levothyroxine, Synthroid, and Tirosint, are the most widely prescribed thyroid medications and have an extensive safety record. They also offer precise dosing and stable blood levels, which is why they're considered the standard of care for many patients. The primary limitation is that T4 must be converted into T3 before your cells can use it. If that conversion isn't happening efficiently, some people continue to experience symptoms despite treatment. It's also worth noting that inactive ingredients and fillers can vary between brands. Liothyronine, also known as Cytomel, contains the active thyroid hormone T3, so it doesn't require conversion. For some individuals, adding T3 may help improve lingering symptoms. Because T3 has a short half-life, however, it requires careful dosing and can produce rapid changes in symptoms if not managed appropriately. For that reason, it's rarely used as a standalone therapy and is more commonly prescribed alongside T4. Prescription glandular products, such as Armour Thyroid, Nature Thyroid, and NP Thyroid, contain naturally occurring T4, T3, T2, T1, and calcitonin. Because they naturally include T3, some patients report improved symptom relief and appreciate the broader hormone profile. Now, these medications are derived from porcine thyroid tissue, and the T3 content is proportionally higher than what the human thyroid normally produces. As a result, they may not be appropriate for everyone, and some practitioners have concerns about their use in autoimmune thyroid disease. When we think about thyroid medication, we often focus on the hormone type and quantity, but the inactive ingredients deserve attention too. Depending on the product, fillers may include corn, wheat, or dairy-derived ingredients, along with coloring agents, binders, and stabilizers. One additional point many people don't realize is that unless your prescription specifies no substitutions, the pharmacy may switch between generic manufacturers. While the active ingredient remains the same, the fillers can change, which may be important for individuals with food sensitivities. Compounded thyroid medications are custom-made by a compounding pharmacy based on your provider's prescription. One of the biggest advantages is flexibility. They allow for customized T4 to T3 ratios, precision dosing, and greater control over inactive ingredients and fillers. They can also accommodate unique dosing requirements for highly sensitive individuals. The downsides are that they're often more expensive, frequently aren't covered by insurance, and not every physician prescribes compounded medications. Their quality also depends on the compounding pharmacy preparing them. Not all over-the-counter thyroid glandular products are designed to do the same thing. Some high-dose glandular supplements are marketed as a do-it-yourself alternative to prescription thyroid medications. Organ meat supplements, on the other hand, may contain thyroid tissue in much smaller amounts and are generally intended to provide nutritional support rather than meaningful thyroid hormone replacement. Understanding that distinction can help set appropriate expectations. One advantage of over-the-counter thyroid products is that they don't require a prescription, giving people more flexibility to explore different options. However, they aren't intended to provide consistent thyroid hormone replacement. Hormone content may vary. They're less regulated than prescription medications, and results can differ significantly from one person to the next. The important thing is to understand what these products are designed to do and whether they're an appropriate fit for your individual situation. No matter which medication you and your healthcare provider choose, it's important to remember that medication is only one piece of the thyroid health puzzle. Medication can improve hormone levels, energy, and metabolism, but it doesn't address the underlying factors that may be contributing to thyroid dysfunction. Things like autoimmunity, nutrient deficiencies, gut dysfunction, chronic stress, inflammation, or environmental toxins. That's why I believe the best outcomes come from combining appropriate medical care with a comprehensive root cause approach. I like to think of thyroid medication like choosing a route on a road trip. Two people may have the same destination, but the best path to get there isn't always the same. Some people do very well on T4 alone. Others feel better with a different formulation or a combination approach. The goal isn't to find the medication that works best for someone else, it's to find the one that works best for you. If there's one thing I hope this video has done, it's given you a few better questions to ask. Like, is my current medication working optimally? Am I converting T4 into T3 efficiently? Would a different formulation be worth discussing? Could fillers be contributing to my symptoms? And are there lifestyle factors that may still be affecting my thyroid? The best outcomes often happen when informed patients and knowledgeable practitioners work together. If these questions resonate with you, consider taking a screenshot of this slide or jotting them down before your next appointment. As we wrap up, I'd like to leave you with 3 key takeaways. First, there is no universally best thyroid medication. The right choice depends on the individual. Second, medication decisions should consider more than just a diagnosis. Your symptoms, lab values, lifestyle, sensitivities, and personal preferences all matter. And finally, remember that medication is only one piece of the puzzle. The best outcomes often come from combining appropriate medical care with nutrition, sleep, stress management, movement, and a thoughtful investigation into the root causes affecting your health. If you're still struggling with your thyroid despite taking medication, I'd love to help. I offer a complimentary strategy session where we'll discuss your health history, your biggest challenges, and whether a root cause approach may be the right next step for you. You'll find a link to schedule your free strategy session in the video description below. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and share it with someone who could benefit from it. I look forward to seeing you in the next video. Bye.